So Bob, we've begun a discussion about posting the live link on Facebook or not posting it. So, I mean, we have it on our website. So people have it available to them through the e-blast. You want to start tonight by not? So Bob, we've begun a discussion about posting the live link on Facebook or not posting it. So, sorry about that. I mean, we have it on our website, so people have it available to them through the e-blast. You want to start tonight by not? So Bob, we've begun.
What are the pros and cons, Tim?
Hold it, I'm getting some feedback here. Hold on.
Okay.
I think they're live, Bob.
Okay, it's just a larger discussion about whether you want it available to the public or not. We're just not going to do it tonight.
Yep.
Okay.
Agreed. Correct.
You are live, guys.
Yep.
Okay, 4:58, we've got 2 minutes to go.
All right. Thank you, Tim.
Jason.
Join the meeting.
All right, it's 5 o'clock and welcome to Big Canoe.
Thank you, Tim, and good afternoon, everyone. Welcome to the July board session. This is the first. This is the first work session we've had during the pandemic where it has surfaced in Big Canoe. And we'll have a presentation later on by a special guest. Before I do that, I'll turn it over to our general manager, Scott Auer, for the operations update.
Good afternoon, everyone. As President Crouch said, we had 3 employees in the last week that have tested positive with COVID-19. 2 of those employees were working in areas where they had really no contact with property owners. And one of the employees was working in an area where they were serving property owners. However, the person serving the property owners was following all of our guidelines, which basically, actually they're mandates for our employees that basically say you're going to be wearing a mask when you're at work and when you're interacting with property owners. And if you're serving food or anything of that nature, you're also going to be wearing gloves if you're preparing food. So this individual was wearing all their PPE as they were supposed to. It's not defined by the CDC as a close contact situation because they were not within 6 feet of property owners for a minimum of 15 minutes, and they were wearing their PPE. So although, as we said in the email, if you had been at Duffers, which is where this individual was working, we recommend that you take all reasonable precautions as the CDC has been directing for months and as we've been sharing for months. But this was not a close contact situation. So the other employees we've traced back through their daily operations and who they came in contact with. Anybody that they were in contact with for a significant amount of time over, in that 15-minute time frame, those folks have been tested. They're self-quarantined. So we're minimizing, any chance of that spreading further within their departments. And just so everyone knows, we do monitor temperature every day of every employee when they report to work. And practically every morning, there's a group meeting where we again stress to employees that you will be wearing masks. You need to be using tons of alcohol-based sanitizer. You do need to be maintaining, even though you have a mask, wherever possible. Obviously, if two guys are riding in a maintenance cart, they can't do it, but they should be wearing masks. Wherever possible, maintain that 6-foot distancing. So we're doing everything that we can to protect our employees. We also, as we mentioned in another email, the state of Georgia has strongly suggested that masks be worn. Our employees certainly appreciate the fact that you wear masks. So I, for one, when I go to the club, I'm wearing a mask until I'm seated at the clubhouse and actually eating my meal, and then I take my mask off so I can eat my meal. So anything you can do to minimize contact with our employees by having a mask on when you're in their presence, it makes them feel safe. It makes them feel that you care and that you're paying attention. And it also helps with the safety of our entire community. So it's a really important, good thing to do. Someone asked me, or several people asked me on email this week, why don't we just mandatorily perform tests constantly of all of our employees? And my experience in the state of Georgia, and I've done this several times, both at Big Canoe and in my older business, it's now taking a minimum of 2 to 3 days to get a test scheduled. Many places won't even schedule a test in Georgia unless you've exhibited symptoms. And
Join the meeting.
And unfortunately, it's taking 5 to 10 days to get the results back from the test, depending on how busy the lab is on that particular day. So you instantly kind of see the problem. By the time we get the test scheduled for the employee, they're going to go through their life for another 5 to 10 days where they're going home, they're interacting with family. You don't know where the family's been. I mean, all of these things, they're meeting other people. They're going to, they're going out for dinner. They're going to a grocery store. There's even if the test eventually comes back negative, 10 more days of their life have gone by. So the test is kind of irrelevant at that point in time. So it's just with 200 people, with the condition of the state of Georgia testing at this point, it's just not useful to be, it's kind of meaningless to be sending folks for tests, on a mandatory basis. There's too much time in between the tests and it just kind of makes it irrelevant. So that's why we constantly follow the executive orders from the state of Georgia. We're constantly monitoring what the CDC comes out with, which is changing all the time. We're always going back to the basics of wear the masks, keep the 6 foot, monitor temperature every day when they come in, do everything we can to separate employees wherever possible. And again, we really appreciate it if property owners take the stance of doing everything to protect each other and to also protect our employees by wearing a mask. So that's the summary of where we are right now with COVID. We'll certainly take any questions at the end. Changing tacked a little bit, talking about food and beverage. I should also say one more thing. Just as a precaution, we did have duffers where the employee worked. We had it professionally cleaned and sanitized. And not our normal housekeeping folks who are doing that kind of work every day, but this is the real deep cleaning, professional disinfecting. And as a further precaution, even though the employee really hadn't interacted at the clubhouse, we went ahead and had the clubhouse kitchen and food prep areas done at the same time, just to be extra safe. So that's part of our protocol as well. If something like that would happen again, we're ready to call that facility in and take care of the issue. Speaking of food and beverage, so you've seen Duffers is closed since last weekend. Duffers was ready to reopen basically after 24 hours. The problem we're now having with food and beverage, which has led to the swim club snack bar being closed and Duffers still being closed until tomorrow, is the fact that because of COVID and because of the resulting unemployment benefits that are being given to so many folks at the moment, our candidates for food and beverage employment is dramatically lower than it's ever been before. And for those of you who've been here a while, you know that sometimes hiring here is a little harder than hiring in Swanee or Alpharetta, but it's really hard now because the unemployment benefits are so strong that people are just like, I'd rather stay home, self-isolate, be safe, and make an extra $600 a week. So that's ending soon. We're hopeful that that opens up our employment application stream a little bit more, and therefore we would be able to get back to being a little more fully staffed. That is why we had to suspend curbside dining at the moment. It's why we had to suspend the food service at the snack club, swim club, snack bar, and it's why we're also still closed in Duffers. My direction to Robert Sabat, our amenities director and food and beverage manager, has been make sure that whatever we do with excellence. So if that means we have to scale back for a little while and close some of these facilities, I would rather do that and make sure that the dining experience at the clubhouse is as good as we can possibly make it. And so that's what we're doing. I'd rather do less and do it better. So the other last piece of news in my section would be, some of you may have heard that Chef Albert is leaving us. He has actually gone at this point in time. He resigned due to, not because Big Canoe was a bad place to work or anything terrible like that. He resigned because, quite frankly, he took a job that was easier. He's going to a club that does a huge amount of banquets and catering, which is much, much easier work for a chef than dealing with a la carte dining, which is our primary business here. And also it was closer to his family. So he made a personal decision to do that. So we are in the middle of a search for a new executive chef, and have a couple pretty promising, interesting candidates already. So Robert's been doing some tours this week, and we hope to be able to announce that addition to our food and beverage operation pretty soon. And Bob, that's all I have at the moment. I'll turn it back over to you.
Scott, thank you very much. Appreciate it. Are there any questions of Scott from the board? Hearing none, I will introduce our guest speaker. Very timely as the environment that we're in today. I contacted Peter a couple of weeks ago and asked him if he would agree to present his deep knowledge of the subject that we're going to be talking about, the COVID-19 pandemic. And Peter graciously agreed. He has impeccable credentials that I won't go through because Peter does a better job in his presentation of introducing himself than I would. So Peter, it's all yours. Thank you very much for agreeing, and the presentation's all yours.
Thank you, Bob. And thank you for inviting me to do this presentation. I hope you can see it now, the screen. Yeah, I was asked to talk a little bit about COVID-19 after I had sent an email to the chairman of the Men's Golf Association here at Big Canoe, because I was a little bit worried about things. 3 weeks ago, we began to relax on. Can you hear me? No, yes, you can. They were relaxing some of the restrictions on golfing, and I could see that things were turning up or there were coming more coronavirus cases in Georgia, and I was afraid of what was going to happen in Big Canoe. And it's better to be proactive than retroactive. And thankfully, the golf guys they did restrict things again, especially they're using single driver cards now. So why should I talk about all this? Who am I? I'm a Danish American who have lived in the US since 2005, and I've been a resident of Big Canoe since 2010. My education is that I'm an MD and a PhD from Denmark. I've never practiced MD in the United States, but I'm also a specialist in clinical microbiology, which is a mix of microbiology, infection control, and infectious diseases, which is something that is important in public health. And I guess that is probably the reason why CDC wanted to have me here. I worked in public health for more than 30 years, and since 2005, I've been the branch chief of the branch that is responsible for the laboratory surveillance of bacterial foodborne illnesses in the whole United States. That is infections caused by Salmonella, Campylobacter, or E. coli, if you're interested. I retired in March. But with that background, I know quite a lot about outbreak investigation, dynamics, infection control, and how to use public health data. So even though I'm not pretty familiar with virology, I know a lot about outbreak investigations and how to deal with the situation that we are in right now. So what I'm going to talk about is what is COVID-19 and why should we care about it, show some disease trends in the US, well, maybe not so much US and Georgia, and what does it mean? And then, of course, since you probably all know that the numbers are low in our areas, why should we bother about it? And then finally also a remark on fighting COVID. There's been so much talk about in the press about flattening the curve, but flattening the curve is not just about flattening the curve. It also means that we have to get the numbers down. So what is COVID-19? It's a respiratory disease that is a lung disease caused by a new coronavirus with the fancy name SARS coronavirus number 2. It's a virus that has evolved from an animal disease-causing virus in China by mutation, and it has adopted to humans. It is a virus that now is extremely infectious. It spreads very easily between people, and it transmits via respiratory droplets. So whenever you cough and shout and sing and talk, you are spreading the virus if you are infected. And what is very important specifically for this virus is that it also transmits if the patient has no symptoms. That makes it much more difficult to control the outbreak, and it makes everything dealing with it much more complex. I'm not going to go into details about the symptoms of the disease, because if you have followed the news just about just a little bit, you know what the symptoms are. But I want to emphasize that most patients only have mild symptoms, and many have no symptoms at all. And that is specifically children and younger adults, not the elderly like us up here in Big Canoe. There are few patients that have severe symptoms and even fewer who die. But I also want to emphasize that if you recover from COVID, you have had severe symptoms. You will have symptoms from the lungs, problems breathing, running out of breath easily for quite a long time. And it might even be or chronic lung disease you are going to have. You are going to be tired for a very long time too. and you can also have heart conditions with this. And then you can get PTSD. That is not just something you can get if you are in a war zone. You can also get it if you have a dangerous disease like this one. You can get strokes, and you can also get brain function diminishing. I'll just mention the most severe or the most common risk factors for severe disease, and that is, of course, old age. If you're obese, if you have chronic lung disease, or if you are immunocompromised, if you have diabetes, and if you have severe heart disease. But there are other risk factors also. But these 5 listed risk factors are extremely common up in Big Canoe, and that is why we should think about COVID and take it seriously. And this is just a cartoon that I found is illustrative, because we hear about younger people who don't care about the coronavirus, and in this cartoon, it's Little Red Riding Hood says, "I'm not scared of you. I'm young. I don't need to self-isolate. I can do whatever I want." And then the coronavirus wolf says, "I'm not here to follow you. I'm here to follow you to grandma's house." So what we need to think about is anybody who gets infected can transmit it to somebody who really can get sick. You also know about the risk factors. I'm not going to mention all the risk factors and the risk activities you can do, but I want to emphasize 2 that are important to the residents of Big Canoe. That is, if you go outside Big Canoe to visit family and friends, you are running a risk. And if you are receiving visitors, family and friends also from the outside, you are also running a risk. Not so much by you infecting those, but the visitors infecting you. And remember, kids are very often asymptomatic. So grandkids and things like that, I would be careful meeting too much with them, even if you have the opportunity. I haven't seen my American grandkids the last 3 months, and I had also planned to go to Denmark and visit my family there. And it's not just because it's difficult to come to Denmark, but I don't want to visit them at the moment. It's too dangerous. So just a little bit about if we need to take COVID-19 seriously. There's been so much talk about flu or COVID is not worse than flu, but that is definitely not true. On the left here, you can see a graph that shows the number of illnesses and the deaths caused by the flu the last 10 years. And on the right, you can see the number of illnesses and the number of deaths caused by COVID here in 2020. And you can see the number of COVID cases are less than the average numbers in the 10 last year for flu seasons, but the death numbers are higher. So, and if you do some math on it, you can actually calculate that COVID-19 is 4 to 10 times more deadly than the seasonal flu. So this is definitely something that we need to take seriously. Then I'm showing you a graph that I prepared of the weekly numbers of new cases of COVID in Georgia. I pulled those data from the Georgia Department of the Public Health websites. They don't display this graph, but you can make it yourself. And I've updated it with the numbers every Friday, so I really can't see. But you can see we had a peak in early or mid April with a little more than 5,000 cases, and then the curve flattened out, and then here in the end of almost the end of June, it started rising again. And we're now with more than 20,000 cases every week. And this week, it's probably going to be 25,000 cases. If you look at the deaths instead, it almost looked positive, doesn't it? Because it looks like the death rate is going down now. But there are 2 reasons for that it looks like this, because it is going up again now. What happened there in the end of June is that more younger people became ill, and they don't die as much as elderly does. And then you should also remember that people who die, they don't, they die a couple of weeks after they become sick. So we don't see the deaths at the same time as we register that they are sick. The death rate is definitely going up now. That's another reason for taking this seriously. There's also been a lot of discussions about if the numbers that you see, the increase we've seen, is that caused by increased testing? People are saying, well, we are testing so many people now that the case counts also goes up that way. And that is true, of course it does that. But you can look at the data in different ways. In the laboratory data, you can look for the trends in the positive tests compared to the test numbers. And you can also check data that are independent of testing. And you can look at, for example, hospitalization rates, and I'm going to show that also. But when I began to worry about this back in 3 weeks ago, I noticed that 1 week we actually had more than 6,000 cases, which was higher than the numbers in April. And then I looked at the number of tests, and it turned out that actually the test numbers had gone down the previous 2 weeks. So that increase that I observed there, it could only be a real one. And if we now also look at the hospitalization rate, you can see the hospitalization is going up. So for sure, we are seeing an increase in cases. There's no doubt about that. The cases has more than tripled since the first peak. So our problem is more than 3 times as big as it was 3 weeks ago. One thing more that I want to mention here is also a remark about flattening the curve. We've been talking about flattening the curve, and it was flat around 5,000 cases for 8-10 weeks or something like that. But that is not good, because if you see a surge after that, when you see a surge in cases, it's an increase, a fraction of the people who are ill or that gets ill, that increases. It's not just 1, 2, 3. It's the fraction of where you were when the increase begins. So if you have 5,000 cases 1 week, and if you then have a surge, well, then the next week you might have 10,000. And that is what we see here. So we probably made a mistake back in April, May there, because if we had thought about getting the numbers down and waited a little bit with lifting the restrictions, we might have been down at a couple of hundred cases by week after a month or so. And if that had been the case, then the situation we would have been in now would be much better. We would only have had about 2,000 cases by now. And that is much easier and much better to address than now that we have more than 25,000 cases a week. There's also been talk about the capacity. Do we have capacity to deal with all the ill? You know that in Florida and Texas and Arizona, they have problems. The ICU, the intensive care units, they are overfilled now, and the ventilators, they are running out of ventilators now. But in Georgia, the situation is a bit better, at least at the moment. There is still 60% of the ventilators that we have available. They are still available to us. And if we look at, if we look at the critical care beds, and what I've emphasized here is in the counties that we would be using from Big Canoe, it doesn't look quite as good, but there are still quite some capacity left. But the 4 big hospitals or hospital systems in Atlanta, they have warned the governor that if we don't do anything, we might be running out of intensive care beds within a few weeks. So that is definitely troubling if that happens. Okay, if you want to look at some data yourself, this website is a good one from the Department of Public Health in Georgia. They provide daily status reports with a number of different kinds of information. And what I like, one of the things that I like about this is that you can actually look at the numbers by county. And you can see the numbers in two ways. It's always total number of cases. So it's basically the whole epidemic, all the numbers in the whole epidemic from March until now, you see. And to the right, you see the raw numbers, and you can see where people live. There's lots of people. There are lots of cases. So it's not surprising, there are plenty of cases in Atlanta. But if you look at the numbers per capita instead, it's completely different. You have plenty of cases in a few, or in many of the counties in the southern part of the state. But this is, to me, if you want to figure out if anything is going on, you need to look at the recent trends. Are the numbers going up the last 2 weeks or something like that? And you need to look at both the absolute number of the increases, and you need to also look and see how big is the increase in fraction of what it was. And this is a slide here where to the left, I have the same picture that, or the same format as on the last slide. You can see all the counties in some color code. It's an old postdoc that worked for me at CDC, who's now working for Mercer University, who's following this. It's quite a lot of work, but she's pulling the data from reports from the Georgia Department of Health, and then she's putting it into this map. And what you can see, this is the increases that they have seen in COVID disease in all the counties in Georgia the last 14 days. And you can see clearly here that the places where it's happening, it's in the eastern half of the state, and in the western, in some of the counties on the western part. And it looks as if it's pretty calm up in our area. You can see Pickens County and Dawson County, where Big Canoe is, it is among the counties with almost no increase, it looks like. But you can also see that Gilmer County has had some increases since, or in the last 14 days. And from the Department of Public Health website, you can also see the trends by county, where you just pull up the county, and then you can see the numbers there. It's a little confusing the way that the data are presented on that website, because what they list is not the day that the patient was diagnosed, but the day that the patient became ill. And for that reason, the numbers, the last 14 days is a little uncertain, because those numbers will be updated with people that are actually diagnosed later. But you can see there is definitely an increase in Gilmer County. And actually, I also looked at the numbers in Pickens, and it looks like there's something going on in Pickens also, and in Forsyth also particularly. Dawson seems to be pretty calm. But I don't know where the 3 employees from Georgia that you heard of before, where they are living. But there's definitely something brewing, and we need to keep an eye on that. When we are talking about controlling COVID, you have heard a lot about contact tracing, and that's a very efficient way to, or the most efficient way that we have to trace COVID during an outbreak like this. But it has some problems. But the principle in doing contact tracing is that all newly diagnosed patients are interviewed about activities and contacts the previous 2 weeks. That is the 2 weeks before they became ill, because that is the incubation period of COVID. And then the contact should be contacted promptly and asked to quarantine for 2 weeks and get tested. And in principle, then you are going to limit the spread. The problem in Georgia, one of the problems in Georgia is that we have a lot of new cases, so it's difficult to get hold of them all. I don't think the public health laboratory or the public health department has capacity to contact all the contacts also. So what we are doing is actually we are asking the patients to contact the contacts, and then have the contacts contact the public health department. That is not very efficient way to do this, in my experience with other smaller outbreaks. It works if the newly infected patients are tested, so there is no significant spread among the people that are not being tested. And it does require that there are relatively few new cases, and the testing is timely, and the reporting of the test results is also timely. So we need to have the results within a day or two. And then we need to have high testing activity, because if we don't have high testing activity, there will be things going on that we don't know about, and then we can't control the outbreak. So as actually Scott also alerted to, this doesn't really work very well in Georgia. There are way too many cases, like I said before, but the testing is untimely. The testing sites are overwhelmed, and they're also running out of supply. So you can't always get tested where you think you can get tested, and you have to wait for a while in order to get there. And for example, the three closest testing site, official testing sites for Big Canoe, they have only opened for 3 or 4 hours one time a week on Wednesdays. And Scott also mentioned the problem with the delayed reportings. There are laboratories that can do it the same day or report it after a few days, but if we need to figure this out, we have to make some phone calls and figure out where we can do things. And the testing activity is way too high, or way too low, I mean, in Georgia. We have a positivity rate of 10 to 15%, which is about 3 to 5 times too low. We need to do better. But this is the whole Georgia. If we want to, we could possibly make it work efficiently within Big Canoe, but we would have to do something to especially make sure that we can get people tested. So this is a slide I made before we actually heard about the COVID cases yesterday. And I predicted that COVID-19 will come to Big Canoe at some point if the situation doesn't improve. And the reason for that is that Big Canoe is not a closed community. We have lots of communication and contact with the outer world. And in that situation, and you have a pandemic going on, you have to ask some unpleasant questions to guide your response. We could just do like we've been doing so far and hope for the best. That's probably not a wise idea to do, but we could also review and revise what we are doing now. And then you have to think about what strategy you should use. And there you need to differentiate between two scenarios. Is it acceptable to have, or well, we will have to accept sporadic introductions into Big Canoe where you have one case here and one case there? Or is it also acceptable to have an outbreak, at least a small outbreak in our community, if we can contain the outbreak so we don't have any deaths? And then we need to think about if we need to be proactive or reactive or both. And whatever we come up with, we need to make sure that everybody who's residing in Big Canoe is okay with what we're doing. And this changed yesterday when these 3 employees were announced positive. And then we have 4 questions at least that we need to ask first and figure out, because they are going to guide whatever else we are going to do. And those questions are listed here. Are these isolated infections unrelated to Big Canoe? Meaning those 3 people who are infected, did they get infected outside? If there are 3 cases in an area that has been diagnosed, you can be absolutely certain that there are also more cases out there. And we need to figure out where those cases are. We also need to figure out, now that we have 3 employees, they can have gone infected from contact to other employees, and they could have theoretically, even with all the precautions we have implemented, they could also infect other employees. So we need to figure out if there are more infections among employees. And I know that some of the employees had been tested by now, and that is perfect. We also have to consider if we have infected residents, and that is important. And I think the way to do that is to, or we can't test everybody up here, of course, but people need to come forward in some way if they have symptoms and get tested. And as part of that, we need to figure out if we have an outbreak that is brewing, because if we have an outbreak, our response has to be much more rigorous than otherwise it would be. I hope I haven't scared off too many people about this. There are a few things that we can do and that we all should do now. And those 2 things have been mentioned before, and I will just mention it again here. If we are not at home, we need to practice social distancing, meaning that we have to stay at least 6 feet apart from people that we don't share a household with. We should all wear a mask also. And even though it has been disputed that the mask doesn't work, I think there is enough evidence now that the use of mask is good. It reduces our risk of acquiring COVID by about 80%. And you should consider this. It is the same level of protection that a vaccination would give you. So this is a very simple way to avoid spread. So we should definitely do it. And this just to show how you have to wear your mask. It needs to cover your face, your nose, and your mouth. If you wear it so it doesn't cover your nose, and I see that a lot, then it doesn't work. You really, you might as well not wear it. Don't do that. And then the final words I have is there's really no need to panic. Panic will never help people become irrational if they panic. But we need to think about what it is we're doing. And neglecting COVID-19, of course, is definitely not going to do any good. And as residents of Big Canoe, we'll have to listen to the POA and the general manager, because you are the ones who are leading us, and you are the one who are responsible for what it is that's going on. And then finally, I would also like to say that since we are in this together, even if we think that we are not personally in risk, we have to think about the risk that we might be posing to other people if we don't follow the guidelines. So we need to be considerate of others. And then on a positive note, the restrictions that we will have on the pandemic and that we have right now, it's really not that bad, I think. At least I can play golf, and I do still play golf. I don't do it exactly the same way that I used to, but that's fine. And actually, my alcohol intake has increased substantially during the pandemic, because I'm socializing more with my neighbors. And we're doing that in driveway parties outside, where we also social distance and just bring our own chairs, food and drinks, and that's pretty good. And there are lots of other things. In Big Canoe, we have all the different outdoor activities that we can still do. So with that, I am done with my presentation as it is right now, and I can take some questions if there are any.
Peter, thank you so much for a very comprehensive, very informative presentation.
I had one question. I was wondering if the change in the reporting that has been done, like with the CDC and all that, do you think that's going to have any type of impact on the way that it's managed?
Not immediately. when you move reporting from one place to another one, there's always going to be problems with that. I've never seen moving reporting from one system to another going quite smoothly. And this one is happening a little haphazardly. So I don't expect it to work, and I would definitely not have made this step during a pandemic. But the kind of data that they are collecting is probably it's also being sent to the state public health laboratories and some of the other agencies in the states. So we will have it, but it's going to be a little more difficult to get the full picture.
Thank you.
Peter, what's the outlook for a vaccine?
Good question. Yeah, well, I thought somebody would ask that question. Immunity towards coronavirus is not settled yet. We thought that a vaccine would be great as long as you have antibodies, then you would be protected. But now we know that people who doesn't have severe disease, people with light symptoms or no symptoms, they will, most of them, develop antibodies, but those antibodies disappear within 2 months or 3 months or something like that. And then, well, what is going to happen? It looks like people who are having severe disease, they have higher antibody responses. And of course, if you vaccinate, you can probably get a strong response. If we don't get a strong response, of course, it's not going to work. But there's also one other hat that will give us a little bit of hope, because there are two types of immune response. There is the antibody response, which is easy to measure, but there is also something called this T-cell response, cellular immunity. And I've seen one study from Sweden that seems to indicate that people with light infections actually have a stronger T-cell response than antibody response. So if the T-cell response, if it turns out that that also protects against infections, then we're good to go. The other part of the vaccine problem, of course, is when is it going to be available? I don't know, and I don't think anybody knows, but I guess Dr. Fauci says that it's possible it can be there at New Year. Personally, I think that's probably a bit optimistic, but if we could have it within a year, that would be nice. Particularly if one vaccine dose is not enough, then it will take longer because we have to produce many more doses. I know the vaccine, the people who are developing the vaccine, when they start the phase 3 studies, that is the ones that are going to prove if it works, they will also ramp up production. So we don't have to wait for the ramping up production, but still, if we have to produce billions of doses, that is going to take some time.
Peter, the question's come up here recently that a lot of the retail outlets, Walmart in the last 24 hours and Starbucks said, you can't come into our facilities nationally unless you have a mask on. That seems to be a growing trend if you look at the list. So I would remind all of our Big Canoe community that better take a look at and have masks with you, because a lot of these places are not going to allow you in. I know there's a question on do they have the authority when the governor says he strongly encourages it but doesn't require it. What are your thoughts on this all around?
Well, to me, it's a no-brainer. Everybody, and I mean everybody, needs to wear a mask when you're not home. You have to do it. It's a courtesy to others, and it's also protecting yourself. There is really no reason for not wearing a mask.
So you would strongly encourage that, even going to the post office, a Big Canoe?
Absolutely.
Wear a mask. And any other area, go into the club and then sitting down and eating, perhaps take the mask off as we would need to. But beyond that, we should be very mindful of that.
Absolutely. It's such a simple way to limit the spread. And the spread is not under control yet. So we need to do all the simple things that we can do ourselves.
The other part of this is that there's a lot of us are all grandparents with lots of kids getting ready to maybe go to school, depending on what state. What are your thoughts in general about for us grandparents and kids going to school? I mean, I think many want to get back to school. I mean, probably the majority, but there seems to be quite a bit of disparity around that. Just in general, your kind of thoughts on that.
Well, kids should go to school, but if you have a high transmission in an area, then it's not safe to do it. So I think the way to do it would be to consider the situation locally. And when I say that the situation is under control, you need to have be down to hardly any new cases in the county you're in, and then you might open up. But if you have active transmission, then it's I would say almost suicide to open up. If you open up and you have one kid that is transmitting the disease, then very soon a lot of kids are going to have it. They might not have any symptoms, but they're going to spread it to the teachers and all the other personnel in the schools, and they're going to spread it to the grandparents and their parents. It would be a disaster if we just opened up for schools in a month.
Well, the reason I asked the question, you have a strong background in kind of European medicine, and of course, Sweden, Finland, Norway, a lot of these countries have decided to keep schools operating, year round for the most part, not maybe perhaps in all cases. So we have this conflicting reporting that says we have all these examples that that perhaps, I liked your first answer, but I thought we should ask you the question since you have a remarkably more background than most of us do and kind of the world picture.
Yeah, well, it's a good question. I think actually most of the countries in Europe closed the schools, but they are reopening now because they have the situation much better under control than we have. In my other home country, Denmark, they have barely any new cases any longer, and the schools were open for the elementary classes the last 2 months or something like that, and it works. The only country that I know is the exception there is Sweden, and Sweden has substantially more cases and substantially more deaths than any other country in Europe has right now, and definitely many more than neighboring countries. Just like the European Union is opening up for travel for people from certain countries, but not the US because we have too many cases. You can't travel from Sweden to Denmark because the Swedes are considered too risky. And the Swedes don't like it.
Peter,
Thank you for your comments.
Thank you very much, Peter. I appreciate it. I hope if you're not too busy, if you could stick around, there'll probably be some property owner questions at the end of the meeting.
Oh, yeah, sure.
Okay, terrific. We will move from a heavy, serious topic to some light and some fun now. We're about to have a 50th anniversary. And Nancy, do you want to present what your plans are for that?
I think I'm going to start with Mark, who's a member of our group. Mark?
Hello, everybody. Can you hear me?
Got it, Mark. Yep.
So what our purpose is here today is our Leadership Big Canoe class of 2019-2020. Our particular group was tasked with creating a charter that would therefore allow the general manager and Big Canoe in general to set up a committee, or what we call a task force, to execute and implement a plan for Big Canoe's 50th anniversary, which is coming up in 2022. So what we are doing today is completing our Leadership Big Canoe class by presenting our work products to the board, and hopefully they will be well received. And I believe that everyone on the board has a copy of the charter, which was in fact the work product, the end final result for you guys to vote on. And we also, by way of exhibit, have our backup material in the form of a PowerPoint that shows the process by which we came about producing the charter. And so you have the charter, and I believe you may have the PowerPoint, but if you're interested in seeing our work product, the PowerPoint itself, the charter is a little bit too fine printy to go through in this format. But if you're interested in seeing the PowerPoint and our work product, then Nancy will share her screen and show you that if you feel like that's relevant in this format.
Is that good?
Yes, absolutely. I
Okay.
think it's not only for the board, but I think the property owners that either are listening in now or will be watching this video in the future. I think there's a lot of interest in this. So please.
Okay.
Yeah, I agree with Regis completely, having sat through all of Leadership Big Canoe last year.
Yeah,
Okay.
please, Nancy, it's all yours.
All right, I'm going to go ahead and share my screen. Okay, everybody can see that?
Yes.
All right.
Yes.
I'm a little more formal than Mark. I wrote up my comments that I'd like to say, so I apologize in advance if it sounds like I'm reading a script. But I want to thank Mark for the introduction to our project. We had a fabulous group to work with. I want to stress that everyone contributed and had a hand in the decisions that were made. Mark and I are just the spokespeople, but everyone in our group pulled their weight and made this a truly delightful experience. As Mark said, our group's mission was to develop a charter for Big Canoe's 50th anniversary task force. First, I'd like to give a little history of how this presentation and charter came to be. When our group was given this project last October, our first task was to do research on several things. Part of our group researched other organizations' charters, both inside and outside of Big Canoe. We looked through these charters and started to develop the framework for our charter. We met several times and discussed and debated how this task force should be structured. We also met with the general manager to discuss the unique character of Big Canoe and how the task force could best use its resources. Several members of our group also researched other communities and how they planned and celebrated their milestone anniversaries. As we all know, there's no other community quite like Big Canoe, so we pulled ideas from several different communities of different ages and sizes. The purpose of this was to give the task force a starting point of suggestions and activities that could be implemented in 2022. While doing this research, our group came to realize the pride and community spirit exhibited in these celebrations. And our hope is that this will also be the case with Big Canoe. These are the members of our task force. We did divide the tasks. Some of us researched the charters and some of us researched the similar community celebrations. Our hope is that we want a broad spectrum of community members to participate in Big Canoe's 50th anniversary celebration. We want their involvement in the planning, the execution, and the celebration. We hope the task force will develop a plan that will have a variety of activities that will appeal to our diverse community. And the majority of our community will find at least one activity that they would participate in during this year-long activity. In developing a charter, one of the first things we did was to create a mission statement for the task force. And this is what we created. The task force will be charged to develop and subsequently implement an overall project plan for the events surrounding the 50th anniversary of Big Canoe in 2022. The festivities will be developed with the residents' overall benefit and enjoyment in mind. Our group then decided on what the structure of the task force would look like. Members of the task force will be solicited broadly across our community through a communication asking for people to volunteer to be on the task force. The task force members will report to the chairperson, and the chairperson will report to the general manager. The general manager will choose the chairperson. The task force will work collaboratively with the POA board, management, and staff. Once the task force is formed, subgroups will need to be created. Our group developed a proposed organizational chart. The task force will work cooperatively with the programs and events department and the communication and marketing department. Therefore, you see the dotted lines to those groups. After looking at what other communities had done for their anniversary celebrations, we came up with 3 subgroups: social events, partnerships, and historical. The social events subcommittee would plan and execute the celebrations for the community, which I'll talk about in just a little bit. The next group, the internal partnerships, would coordinate activities with internal partners within Big Canoe as well as external partners outside of Big Canoe. This group would be tasked to work with various clubs and organizations throughout Big Canoe so that their talents and expertise can contribute to the year-long celebration. Perhaps the quilting group can make a commemorative quilt, the woodworking group can create a bench in the meadows, or the Trails Committee could create a geocache for families to explore the historical areas of Big Canoe. This subgroup would also need to work with people outside of Big Canoe, such as smoke signals or inside the gates, as well as local officials from Dawson County, Pickens County, and the state of Georgia. The final subcommittee would concentrate on the history of Big Canoe. We see some sort of written or visual presentation and time capsule coming out of this group, celebrating the first 50 years of Big Canoe. The second group, the internal and external partners, this slide just shows some of the groups that we identified that would have a role in the 50th anniversary celebration. One of the goals we see for the task force is to use activities already planned for our community in 2022 to eliminate redundancy and to reduce cost. For example, we brainstormed events that happen in our community and how they could be adapted for our 50th anniversary celebration. We see a 50th anniversary logo being developed for merchandise to be sold in 2022. Since Big Canoe was founded in 1972, other activities that could be incorporated could be one of the movies shown during the summer could be from 1972. One of the Terraces concerts could be a band that specializes in 70s musics. One of the acoustic showcase performances could be songs that came out in 1972. The Artist Club could sponsor a craft activity at the Village Station to tie-dye shirts to wear for our weekend celebration. We could also have a trivia that is based solely on Big Canoe trivia and 1972 trivia. We see 2 main events for the social events subcommittee. The first would be a community-wide event, perhaps during the July 4th weekend of 2022. The weekend could kick off with an event at the clubhouse on Friday with the 1970s theme, a community-wide celebration at Playfield Park with games, food, and music for Saturday. At this celebration on Saturday, we could have local leaders reading proclamations. Items such as the quilt could be presented, and the time capsule could be buried at this event. We would finally end that weekend with fireworks on Monday. The social event subcommittee could also plan a more formal event at the clubhouse in November to present the video created by the Big Canoe Historical Group and to conclude and celebrate the year-long celebration. Of course, all of these are just a suggestion or suggestions that were created after doing research on what other communities had done. The final celebration will be created and implemented by the task force once it is formed. The task force should be in place by January of 2021. So planning can take place in 2021 and the celebration is ready to go at the start of 2022. The final aspect of our presentation is the budget needed for this task force. While we do not have specific line items at this time, it would be advantageous to have some funds set aside should the need arise. Once the task force has been assembled and the various subcommittees start their work, this would allow access to some funding should it be required. As this is a time-sensitive project, we feel that having these funds set aside in the budget would be advisable. In conclusion, we see this 50th anniversary celebration as a way to bring our community together, celebrate our history, and recognize what a special place we are honored to call home. Thank you so much for taking the time to listen to our presentation. All of our group members take great pride in being part of Leadership Big Canoe, and we can't wait to see what the task force does with our suggestions. I think all of us are online to answer any questions that you may have.
Nancy, thank you very much for a good presentation and an exciting upcoming event.
I agree.
Any questions from the board?
No, it's exciting, and it looks like you put a lot of creative thought into it. It gets me excited.
Thank you.
Okay.
Again, no specific questions. I just think it's a great idea. The work group has done a lot of good work, and I think it's an impressive work product, and I'm looking forward to seeing some of these things happen.
Great job, Nancy and Mark. Well done. Thank you.
Hey, Nancy, this is Wayne.
Yes.
Do you think 5,000 is what you need, or do you need more than that?
Well, Sue and Mark are kind of our budget leads on that. You know, we were kind of kicking around how much money we would need. You know, we don't have any specific line items. We think of things like printing costs, marketing costs, if we have to put deposits down on anything in 2021, that would be what we would need that money for. Of course, the budget for the celebration would be much bigger in 2022.
So you would think that you'd come back to us in 2021 with, at some point, with a lot more line items that you think
Exactly.
we could. Is there an actual date for the 50th? I mean, we talked about the year, but
Yeah.
I went back and looked at this. And
It is October of 2022.
Okay, so that kind of fits into a lot of other things we could do
Yeah.
to support you, and the weather could be a little better.
Yeah. Yep.
One of the things
Hey, Wayne, before you move on off the budget, basically, we came up with that number as kind of a seed number for the task force to have in case they incur some costs doing some research or something of this nature. Then the big request for funding will come in the next budget category.
Makes sense. I didn't know if you needed more seed money, Mark.
You know, we just couldn't really figure out why we would, because a lot of it's just boots on the ground from volunteers putting the intellectual brain power to this thing to make it happen.
Yeah, so your strategy would be, if you need it, you're going to come back to the board and say, look, to make this thing work, I need this and this, and you're going to lay that out for the board so that they can help you make this work in a timely fashion.
Yeah.
I'm just trying to get some placeholders in the budget for you that would be, we could put in this year for next year to make it a little bit easier.
You know, we're always open to
I know
your discretion.
Well, I wanted to make sure you knew we had discretion.
Good.
In terms of the state, what do you visualize might be some things we need to reach out to in the statewide? Other resources to back you up and make this easier for you?
Are you talking as far as presenters and people that would come in and do
No, I'm
things
talking
now?
money donators. Well, you know, there are a lot of agencies out there that can do things. And we have a lot of people in Big Canoe that actually know all those people. And so there might be a value added in having a small team that can help you reach out to these people without interfering with what you're trying to do.
I think that's something that would be very important for the task force to do.
Yeah, and one thing, Wayne and board, that we tried to keep in mind was that our group's our task was not to produce this. It was to produce the task force. And so we have a lot of these ideas, but we had to rein it in to where we were not taking time in implementation when really getting the task force created was our goal.
What do you need from us to get the task force created specifically, besides the money? Just an approval?
I believe that's the case, yes.
Okay. Just wanted to
Okay.
make sure the board knew that so that we know what our next steps are to make this
You know,
efficient for you.
I was having a thought too while they were describing some of the things they wanted to consider. I thought, well, would it be good for us to take a step now, like to Wayne with our liaisons with the county commissioners and things? Would it be good for us to reach out now so we can ask them to start researching? They'd have time to do that. Then we could get it to the committee and they'd see what they have to work with, and then they still had plenty of time to move from there. Just a thought.
Okay, hey, thanks again.
One thing I'd like to point out, Bob.
Yep.
Speaking of the budget belongs to our general manager, Mr. Auer. We approve a budget. So Mark and Nancy, I would think any budget request needs to be made or to include it in the 21 budget needs to be made through Scott, and then the board, of course, would look very favorably on that budget line item.
Yes,
Yeah, that was really my point, Regis. They
And
got to
we-
get something out there for us.
We do happen to have the finance committee chairperson listening in also, that's going to have something to do with that budget after Scott passes it on to her. So next on the agenda is the rules and regulations. Scott, do you want to turn it over to do it, or turn it over to Jason?
Jason, are you on the call to take that?
He's down there muted. There he is.
Can you hear me now?
Yes, sir.
Okay. Thank you, Bob. Really, there's really no substantive changes from the first reading to the second, and from the second to the now the third. I would like to point out that it was brought to our attention that the summary sheet that was provided with this does not have the exact verbiage verbatim that the draft does. It simply summarizes the changes that we're proposing in the draft rules and regulations. However, I would like to say that there were, looks like 2 numbers were transposed on the summary sheet, where it says A3 2.11. Right below there is a 4.1. That should have been a 4.2, which would coincide with what's in the draft rules and regs that's being proposed. And also A4 2.1 should be 2.4, which would then coincide also with what's in the draft. And those are really the only changes that need to be made. Everything else is the same on the summary sheet, as well as in the draft that's being proposed and is posted on the website. So
Okay,
I don't know if I need to go through it again or if there's any questions.
Jason, with those changes, I know there are some property owners that do want to review these very carefully. Is there any reason we can't postpone the vote for these rules from July until August, even though we've had 2 readings? There were these anomalies that are now fixed.
I don't see any reason why it couldn't be extended another month.
Bob, the correct verbiage and correct numbers have been live on the website though. So if anyone is, that's the depository of the true information.
Okay, so we're saying right now that the sheet has been changed and the website is correct.
Yeah, has been correct. Yeah, from the beginning. Yeah.
Okay, the property owners can review that now that they know
Right.
exactly which ones have been changed. And if the board is okay, I'd say let's wait another month. I don't think there's any reason to rush to something that somebody might have not had a chance to review properly. Okay?
Okay.
Fine by me.
Thanks, Jason. Appreciate it.
Hey, Scott,
Thank you.
can I ask you a question? As you and I talked about this a week or so ago, we did get a email from a property owner, and it's following hot on the heels of the previous Leadership Big Canoe proposal. But there was apparently a Leadership Big Canoe team that made a proposal maybe last year, the year before, about taking a look and possibly revising the whole process or procedure used to revise our rules and regulations. And you were going to reach out to this individual to see where that was, if it would be possible to get a summary of that, what the suggestions were. Can you just let me know where we're at with that?
Yes, so the request has been made. The information that I've obtained at the moment is just that, you know, the team went through a subset of the rules and regulations, and at that point in time, the same thing was happening in the general manager's office. I could summarize for you the comments that I've received about that. There was definitely some suggestions on where the POA should go forward, and I'll share that with you, and we can kind of go from there. The Leadership Big Canoe looked at a subset of the rules and regs, and in so doing came up with a few suggested process improvements. So I'll share that with you. We can probably talk about that.
Okay, that's fine. It wasn't on the agenda, so I don't want to get into it. But,
Yep, no problem.
Yeah,
We've got it. We've got a few recommendations.
good. Thank you.
Okay, thanks, everyone. Next on the agenda is an announcement of the board candidates. As I do that, I'd like to first of all acknowledge our election committee, a hardworking group of people that work diligently to get candidates to raise their hands to do this wonderful job of being a director that has excellent benefits, excellent pay. I could highly recommend it, and they were able to find two individuals to raise their hands. One is Bob Littell, and the other is Amy Tropfenbaum. Thank you to the election committee. Thank you to the candidates for agreeing to run. And with that, I'll turn it over to Amy, one of the candidates, to introduce the candidates to join the finance committee that we will be voting to approve next week at the board meeting. Amy, it's all yours. But you got to get off mute there, Amy.
At the end of this year. And so we conducted interviews to fill the 2 opening positions for next year, as well as Scott's position when he moved over to the GM role. We're recommending the following 3 very capable candidates to be approved at next week's board meeting. Elaine Fitzgerald to serve out Scott's term plus 1 extra year. Jim Keneally to come on as a non-voting member until January of 2021, and then to serve 3 years. And Bill Thurber to also come on as a non-voting role until January 2021 till 23. You all have their resumes, but just very briefly. Elaine has a degree in risk management and many years in the insurance business, as well as financial advisor at UBS. She's a graduate of Leadership Big Canoe and helped out briefly with the POA for about 6 months before resigning and volunteering for the finance committee. Jim has both a master's and doctorate in higher education, and he served in senior level positions, vice president or president of several universities. He has extensive experience with strategic planning, financial management, and business development. He currently serves as VP of Student Affairs at UNG. Bill Thurber has MBA in Corporate Finance, 40 years of experience at a variety of companies at the VP Finance, CFO, and Treasury level, and most recently was Executive Vice President of Finance for a large distribution company. He's also served on his Big Canoe Neighborhood Board for 10 years. So we look forward to their approval next week and joining us for the remainder of the year starting in August.
Thank you, Amy. They have a tough act to follow with you losing Scott and you.
They're going to do great.
Looks like you found some good candidates. Any questions of Amy? Okay, we'll go on to the last agenda item. Candy has a very brief update on the status of answering some of the questions that were raised. After that, I'll entertain a motion to adjourn and we'll go to property owner questions and answers. Candy?
Thanks, Bob. Yes, we've had well over 20 questions and most of those have been responded to as of this afternoon. A number obviously on COVID-19 in the recent days. What I do for the actual board meeting is assemble a Q&A by category with our responses, and that I will review or summarize at our official board meeting next Thursday.
Thanks, Candy. That was very brief, very concise. Thank you. Is there a motion to adjourn?
I so move.
Is there a
I
second?
second it.
Any discussion? Hearing none. All in favor, say aye.
Aye.
Opposed? Okay, we're adjourned and we're ready for questions of property owners. Tim, what do we got? Tim, are you there? Anybody here have any questions of ourselves?
Yeah, where's Tim?
Yeah, that's a good one. Okay. He might have fallen asleep. He's been so doggone busy lately. I don't think he's...
We have an exciting presentation coming up on Saturday for everyone. But for now, we have questions from the audience.
Okay.
Well, it's good to know you're alive and well.
Stacy Johnson, lot 5589 asks, do we have residents infected in Big Canoe? Rumors are making the rounds with actual numbers attached. Are they rumors?
That's all yours.
I have no way to know that. I have no way to know that. I mean, obviously, you know, we have to follow HIPAA laws and things like that. So I'm a property owner like you all are. And, you know, if somebody was sick in my family, I don't think I'd be sharing that with my neighbors. So unfortunately, I have no way to know.
Okay.
Hey, Bob, I went on this, one of the key sites that tracks both Dawson and Pickens, and Dawson's at 187 with only 3 deaths, and Pickens is at 130 and 5 deaths, and that really hasn't changed. So if something's happened in the last couple of days, Peter might know something different, but that's been pretty steady. And if somebody's got it, it might be in one of the numbers, but we don't have a way to know that specifically.
Yeah, as Scott said, with HIPAA the way it is, we just do not know. If somebody volunteers to tell us, they would, but nobody has, so we don't know. Next question, Tim.
Well, maybe I might comment on that.
Sure.
It might be a good idea if the board created a little group that could take on this kind of information, because people can volunteer the information about infections to the board. And in order to be able to figure out what is going on in Big Canoe, it is important that somebody knows who is sick and how many people are sick in Big Canoe. If we can contact the Georgia Department of Health and they will do it, then that's fine. But if the Georgia Department of Health is not doing, we might have to do it ourselves. And otherwise, I might help with some contacts to CDC, but CDC is definitely not going to do anything unless Georgia Department of Health says they can't.
Peter, are you suggesting maybe just announcing that if any property owner is ill and wants to volunteer that information to call Scott or beyond?
Something like that, yes. And then we keep track of it.
You're saying, Peter, without any names or anything, but maintaining the privacy, but still maybe having a better sense of what's going on.
Well, people can decide whether they want to provide information about their names and address and all that. And if the Georgia Department of Health is going to get involved, they will probably get all that information anyway, because if they want to follow up on patients, they will have to have the contact information. won't they?
Yeah, for contact tracing, I understand.
Yeah.
Bob, I suggest we'd also check with some counsel on that.
Okay.
Yeah.
Have Ed, did you get a call back from Kim yet today?
I did.
Okay, yeah, why don't you include that in your conversation and
Yep.
see what she has to say.
Yep.
Okay, next question.
All right, Judy Scholler, lot 2277. If you are outside and 6 feet apart, do you need a mask?
In theory, no, you don't. But in practice, why take off the mask? I think the places who are now mandating the use of mask, they recommend that you carry it on at all times, and taking it on or off can be quite laborious.
Hey, Scott, do you have anything to add to that?
I would just say, many times we're in a situation outside where people are perhaps, at an event or something, and they're laughing and they're joking and they're talking loudly. And, I would personally feel safer if the person I'm talking with has a mask on.
Yep.
Oh, I totally agree. If you are at a gathering, then yes, you definitely need to keep it on.
Right.
Okay, next question.
All right, Roger Hackler, 8107. Peter, is there a correlation of increased deaths from other causes due to fear of SARS-CoV-2? For example, people being afraid to seek normal care or delaying care?
I haven't seen any of that data, but it would be logical in a situation like we have right now, where access to healthcare is not as easy as it was before this crisis. That people will delay going to the doctor, and then of course, if you delay seeing a doctor, if you have a stroke or if you have a heart attack or something like that, then you might die. And of course, in the long run, if this goes on for a long time and you don't go to your doctor when you feel a little ill, you might have a cancer that should have been diagnosed in time, and then something will happen. But I'm pretty sure that there are no data on that kind of information right now. But in theory, it could happen.
Okay, thanks, Peter.
All right, thank you very much for your answers. That concludes the questions from the audience.
That's it, huh, Tim? Okay,
Thank you.
Peter, thank you once again for all of your time and trouble to make a presentation. Appreciate it very much. Very helpful.
Thank you. It was fun.
Thank you.
Thank you.
Thank you.
See you all Saturday at 10, huh?
Okay.
Everyone to come out Saturday at 10 for the same session. So it'll be the information. So be sure and tune in right here.
Absolutely.
Thanks again to the Leadership Big Canoe Group and all their supporters for presentation tonight.
Very well done.
Yeah, good job.
Great job.
Thanks, Mark. You do this every day. It's 2 days in a row. We can see you tomorrow, I guess, huh?
I know, this is becoming a habit.
Yeah, it is. People are going to talk.
We'll pay you the same money we get, Mark.
Yeah. I like the pay grade.
Maybe more.
No adjournment, okay.